Hi everyone, welcome to my new channel. This is my very first video. It's super exciting. So Hopeful Bluebird is my company. I do counseling and consulting services. I'm a leadership consultant and also a counselor helping with mental health. I'm focusing right now on first responders and frontline workers, provide group and individual therapy, and also with organizations that I've had to shift to a different model, helping employees stay connected and just creating a very positive workplace culture, clarifying their goals, aligning with their values, and just making sure that the employees are feeling valued. Also do some leadership skills and trainings in mental health and burnout for organizations. Okay, so a little bit about my background, and the topic for today is actually COVID-19 and anxiety. So it's obviously very normal to feel anxious during this time. A big part of it is also the unknown. So nobody knows how long it's going to last or what our life is going to look like. And that unknown is a big factor in the anxiety, right? So usually we'll feel more comfortable if we know what's going to happen next, or if we know this is only going to last 1 week, right? So we can prepare ourselves. But our brain has problems with the unknown. There's a big fear there. Our brain likes to know and plan for our survival, and that part causes additional stress. So there's a difference between stress and chronic stress. So if you're feeling stressed before public speaking or making videos in public, that's different than a chronic stress response where the brain and the body is having long-term effects based on stress. So a couple things I wanted to talk about is what happens when we're having that reaction. So when there's a stressful event, usually we have three options. We freeze, we run away, or we fight. So the three F's: freeze, flight, and fight. But those are more for short-term stress. So when we're in a long-term stress situation, our body is in the middle of that. So it's like before that response, it's in limbo, and it's very difficult for our brain and body to know what to do, as I talked about earlier, because we're in that frozen time before we make those decisions. Even though freeze, flight, and fight isn't a decision, it's a subconscious response. So we don't consciously know what we're going to do. So it's our reptilian brain. So that controls that. So we don't know what to do. And the reason I mention that is because sometimes people have guilt about the way they responded, that they froze or they ran away when they had thought that they would have, been fighting. So you don't make that choice. So there's, it's not really helpful to feel guilty about it because you didn't have a conscious choice in the matter. So hopefully that helps a little bit with the guilt. All right, so chronic stress, we have adrenaline when we're feeling stressed and when we're about to fight or run away. So the adrenaline hits us, but then it ebbs away. But when we're in a constant state of heightened adrenaline, we get jittery, we get nervous, and it affects us in many different ways. So a couple of things I want you to keep in mind is your sleeping pattern. If your sleeping pattern has changed, which obviously very normal, and most people's sleeping patterns have changed, but that's also an indicator that you're stressed out and there's a chronic stress situation. I know I've had the same issue too. Like my sleep patterns have changed. I don't sleep that much, or I wake up really early. And so we have to try to counterbalance that to give us more support. Our appetite, we might be eating too much or eating too little. So those kind of changes. So just kind of the basics. We start at the basics: our sleep, what we're eating, and are we taking care of ourselves? Are we taking a shower? Are we brushing our teeth? So all those self-care strategies. And if it is affected, I would definitely suggest making that a priority. So making sure you're waking up, you're taking a shower, you're brushing your teeth, you're setting a structure and a pattern for yourself so you know how your day is going to go, even if obviously your day has changed from before the pandemic, but creating a new normal. So you're creating a feeling of safety for your mind and body, like there, you know how your day is going to go and you have it structured. It makes a big difference. So I definitely suggest doing that. Self-efficacy, so that means that you know that you can handle certain challenges. So something that you can do is create positive choices for yourself that you have control over, because that helps take your power back. Because I think a big part of anytime there's a distressing or disruptive event is that we feel powerless. We didn't agree to this event. We had no choice. It just happened to us. And this could be any event, but I'm focusing on the pandemic, but it applies to other events. So we need to take our power back. And how we do that is by making choices for yourself that you are in control of. So what you eat, your structure for the day, when you go to sleep, when you wake up, if you want to create some type of a schedule for yourself. So making choices that you know you're in control of, and creating a safe environment also. So it kind of goes with the structure. So just whatever makes you feel safe. I would also consider, what are your coping skills and what has made you feel safe in the past? Do you feel safe taking a bath? Do you like doing oils for different scents? And I bring that up because that's a big coping skill, mindfulness, which is using your five senses. And so anything that you're using within those mindfulness exercises would create a sense of safety. And I would pay attention to how you feel. Do you feel calmer? Do you feel like you're in a safe place? Are you thinking about anything? And if so, what are those thoughts about? So if all those three things are in a safe type of mindset, so your thoughts, the feelings you're experiencing in your body, and your environment and how that makes you feel, like that interaction. So that's what I would consider for creating a safe environment. Having hope for the future as well. So we don't know the future, and it probably is going to look different than what we've had in the past, but still having hope that there are some positives that would come out of it, or that, obviously there is a future that we have hope to get to. So having those hopeful thoughts that we will get to where we're trying to go eventually is one of the most important things. And here, I guess I'll jump into saying that if you are feeling hopeless or really sad, or if you're having any thoughts of despair or hurting yourself, please reach out to a professional, and I'll link some numbers down below for the National Suicide Hotline, and well, I guess the national one would be the best. But you can also reach out, obviously, to any professionals in your life. If you're seeing a therapist, definitely reach out to them. Or if you're in communication with any medical professionals, that could be helpful too. And obviously friends or family that know what you're going through and know how to respond appropriately would be great. If you have any questions, I would definitely recommend that you put them down below. If you have any questions about a routine, how to do a mindfulness program, or the effects of stress in the body, or really anything that I talked about, I would love to hear about your experiences and support you as much as I can. Obviously, this is not therapy. This should not be used instead of therapy, and it's more of an educational video. It's not to treat any mental health issues, as I cannot treat or diagnose unless I was doing a full assessment with you. So that's just a blanket statement for any of the videos that I'm going to do. Okay, so I think that's basically what I wanted to talk about for the first video is just the effects of stress in the brain and body and what we're all going through. And that's the other piece. You're not going through this alone. We're all going through this together. It's all affecting us in some type of way, really all around the world. So even though we're keeping physically distant, it actually is a connecting event for all over from anywhere in the world. People are experiencing this disruption and this type of worry. Probably one of the few events that this has happened to, one of the major events that has linked us as as a community, worldwide community. So like this video if you got some good information. Subscribe as I'm just building this video. Share with anyone who might find this helpful, and I will see you next time. Bye.